when we talk about oral healthcare providers, so everyone knows that oral cancer is a disaster situation. They are calling it a pandemic situation in India. Really, India has the highest cases of oral cancer anywhere in the world, and within that, northern India, you know, Uttar Pradesh, Bihar, Madhya Pradesh, and
even
Maharashtra.
Nagpur. Yes.
Maharashtra, yeah, very very high rates of oral cancer cases. And we do know that over the last 4 decades, very small improvements have been made in cancer mortality rates. So, doctor, do you want to throw some light why over the last 4 decades there has been barely any improvement in the mortality rate of oral cancer?
Oral cancer is not detected early. As in cervical cancer, there are no screening programs for oral dedicated to oral cancers. I mean, so there are dental camps in which they see for caries and infections, but I don't think there are studies which are done on oral screening. So maybe that is one of the reasons.
In India, though, they have done overseas.
Yes. Yeah. So in India, there are not much screening tests done for oral cancer. Another thing is that we have a very poor hygiene of the oral cavity and the dental caries, and this is very high. The third most important factor is that there are a lot of tobacco chewers, smokers, and different type of addictions which are very injurious and insulting to the oral mucosa. And another very important factor is people not aware. People not educated. They don't know that these things may lead to cancer. I mean, it is shown in the films and everywhere that smoking is injurious to health.
Yeah.
Smoking kills.
Yeah.
Even in all the films, they will show it. But how many smokers or how many tobacco chewers do listen to this? Or they feel frightened of this? No. And they're not aware that they should go and have their oral cavity checked from time to time. That is the reason why the incidence of oral cancer is not coming down.
Right. So there are two more things I would like to add. One thing that you mentioned is that we don't have advanced screening tests available, especially for public at large, to screen for the risk of cancer, oral cancer. That's one. And second, we are also seeing oral cancer develop in younger and younger people quite a lot because of HPV. Do you want to throw two bits of lights on that?
Yes, HPV is known to cause cancer, cervical cancer and squamous cell carcinomas of oral cavity because of the changing habits of the early sexual activity in the children, earlier that they start, and the methods are also changing, and that's the reason why the posterior part of the oral cavity is getting more and more affected in younger persons because of the sexually transmitted disease.
Yeah, we have seen people in early 20s get oral cancer.
Yes, and they eat this gutka and pan. That is not related to HPV, but that is also one of the reasons.
Sure, no, absolutely.
Earlier age.
Yeah, the tobacco is a disaster. We know that. Tobacco is a major disaster. But, you know, earlier people used to think, hey, cancer is a disease of old people. We have seen a lot of cases of cervical cancer amongst young girls. And we have also seen a lot of oral cancer cases amongst young men and women both. And clearly we have a huge crisis. So, doctor, how would you tell dentists who say, oh, in my 20 years of practice, including my own personal dentist, he said in his 20 years of his practice, he never detected a single oral cancer case. It's kind of hard to believe when 1 in 3 is a tobacco user, and the risk of developing oral cancer in India is 1 in 10 for males.
So what happens is the patients who go to the dentist, most of them are looking at whatever they are specialized in, they are looking at those problems. Like a doctor who is doing root canaling will barely be aware of these things, or he will not tell the patients that, look, this lesion can be cancerous. So their whole attitude is not towards that. If patients are going to dentists to show them the fleshy growth on the gums or the ulcer on the tongue, but the dentist will say that, okay, there is a sharp tooth, I'll grind it over. But they never, unless the lesion is such that it is very hard and clinically suspicious, they don't even do the biopsy. they do just give them a simple cream or something to apply, and that's why they are unaware that in their clinic lot of cancer patients have already come. But they will always say that in my practice there was not a single case which was detected as cancer. But if they start looking, I'm sure they will find it.
They will find it.
They will.